Impact of Systemic Health on Treatment Outcome in Endodontics by Joanne J. in Brazil 2022. The healing of periapical lesion after root canal treatment is not the result of the creative action of the treatment. The process of healing begins with an inflammation and is resolved by the clearance of the immunogen that induced the immune response. The periapical tissue itself carries out the healing of the periapical lesion by either repair or repair and regeneration, and it depends on the host reparative response working properly. The objective here were to analyze the scientific literature on the possible influences of systemic conditions on the treatment outcome in endodontics, as well as to discuss the biological mechanisms that might be involved. A literature survey was conducted to identify the articles that analyzes the possible influence on the various systemic conditions on the treatment outcome in endodontics. This search was carried out in PubMed, Scope, and Embase, with the inclusion criteria established were the original scientific articles reporting data about some systemic conditions in relation to treatment outcome in endodontics, including clinical studies and studies carried out in animal models. They found out that systemic factors such as age, nutrition, stress, hormones, and smoking habits, and some systemic diseases such as diabetes, cardiovascular disease, osteoporosis, HIV infection, inflammatory bowel disease, and other systemic conditions as inherited coagulation disorders, patients with cirrhosis, and liver transplant condition can influence or interfere with the repair of the periapical tissues after the root canal treatment. For the conclusion, the result of this narrative review shows worse success rate of a root canal treatment with a higher percentage of post-operative radiolucent periapical lesions and a higher proportion of non-retained teeth, associated with several systemic conditions such as smoking habits and diabetes. So this study showed the importance of knowledge of systemic factors for the endodontist to provide comprehensive patient care and for the interaction between dentist and doctors, providing favorable conditions for oral and systemic health to patients.